I am a medical resident in family medicine. I'm about to start my second year. In my experience within the education system, in terms of Aboriginal health and Aboriginal issues, First Nations people issues, it was very, very sparse in my secondary school. There was practically no education in regards to the history of Aboriginal peoples. In university, I tended to study sciences, so we really didn't have any exposure in that aspect as well. In medical school, we did have some exposure to some of the Aboriginal health issues, but again, I felt that 1 hour within 3 or 4 years of med school is not sufficient exposure in order to have healthcare professionals who are able to understand some of where their patients are coming from.
We look at the concept of Aboriginal health and healing. We look at it from the perspective of the medicine wheel teaching. And so we look at it as a combination of 4 aspects: our mental, our emotional, our physical, and our spiritual. When one of those is lacking, then sometimes it can collide with what we have in our other aspects, or the other 3. So if someone has a mental disorder, you are going to have someone who may eventually not be able to take care of themselves physically, and that causes a breakdown in that structure. So if we're able to help compensate and assist this individual in an area that they may need help in, then we're more able to take care of the other aspects of the medicine wheel teachings and bring balance to that individual.
So at the university, as part of the curriculum, we do have a class on the Aboriginal population, including the traditional medicines, the traditional healing, as well as kind of the culture in general. And I do find that very, very helpful, because in high school, when we learned about the Aboriginal population, it's mostly just the historic part of, this is the residential school, this is what happened. But it's really hard to make it meaningful because there lack to context to it. Versus now, as part of the program, we do get presenters who are from the population themselves. So I find it very helpful, because now when I go out there and I, for example, have to help anyone who is from the Aboriginal population, I feel that I can be more sensitive and more understanding to their needs, and really know more about, know more what to anticipate. So that I find very helpful. It also kind of gives me a more open mind, because being able to see more and understand more, just as simple as being able to see the smudging ceremony and knowing what the sweat lodge is, I think is really helpful to kind of understand where the population is coming from in terms of their healthcare perspective.